Welcome back. Maybe it's been months, but for some it's been years. Looking for a solution to your neck and back pain once and for all that doesn't involve surgery. We want to welcome back Dr. Miller, the official chiropractor for the Grand Rapids Griffins with Total Health Chiropractic. Good morning.
Good morning.
Thanks for being here. All right, let's start things off basic. So let's talk about disc injuries. What exactly is a disc injury?
Well, Leanne, we talk about disc injuries quite a bit, and a lot of times patients will say, well, I slipped a disc or, I threw my back out, but what does that really mean? The discs are pads and spacers between each of our vertebrae, the bones in our back. They're there to act as a shock absorber and a spacer so our nerves have plenty of space and don't get pinched. But when people have these chronic conditions, pain in their neck or back or in their arms or legs, what's happening to the disc is it starts drying out with neglect and stresses in our lives. And like a sponge that dries out, they literally shrink down in size, and that's what a degenerated disc is. And they get very brittle and hard, so they're not acting like a shock absorber as much, and it can pinch the nerve.
Right.
Or even tear, and when they tear and that pressure continues to build, that's where they start actually bulging or herniating out, where they push right out into the nerve. But the discs don't really slip. They can herniate, and that's not something that just goes out and comes back in.
Right. So we saw on the screen there some of the things that they might be diagnosed with, and some of the symptoms, obviously the pain, but numbness, that sort of thing too.
And not always just in the neck or the back. It can go down where the nerve travels down the arm or down the leg with sciatica. It can be numbness and tingling, burning, or a lot of times they develop weakness in the extremity where they're not able to use their arm or leg the way that they would like.
And if people let this go and they don't fix the problem, what could ultimately happen?
It's an interesting question because a lot of people think if I just give it time and take it easy, maybe it will heal on its own, or if I take these common approaches that have been recommended, like take these drugs to mask the pain or do shots to temporarily reduce inflammation, maybe I will get this fixed, but those aren't really fixes. And it just continues to degenerate and rot and decay. I think it's almost like a cavity in our tooth where, there's going to be options to treat the pain, but until you actually fix and correct that condition, it progressively worsens.
Yeah, and some of these people are told, surgery is your only option, right?
And that's rarely the case, Leanne. There are a couple of medical emergencies where a back surgery would be necessary, but that also isn't usually fixing the problem of this degeneration. They're just clipping things out to create more space and a lot of side effects. But the problem with back or neck pain and these conditions, like I said, you have to actually fix this problem if you want that long-term relief that most people are seeking.
Yeah, and you offer a non-surgical, non-invasive option. Why don't you go ahead and tell everybody about that? It's really been popular.
And we've been doing this for over a decade, Leanne, so it's just getting better and better each year, helping more and more people. But it's a non-invasive solution. It's called True Non-Surgical Spinal Decompression. And what you see here is a medical device called the DRX9000 that treats these injured areas, reversing the degenerative condition where the discs start to rehydrate and thicken up. If they have the herniation or the bulge that I talked about, that's actually sucked and retracted back into the disc area where it should be in the first place. But we're basically regenerating these discs to help our patients get out of pain, and there are no side effects like death or infection or nicking nerves that people have to worry about. There's really no downtime. They can keep working as they go through the program. So it's really, helpful for a lot of people.
Absolutely. Well, let's go ahead and hear from one of your patients. His name is Harry Weber.
I'm 67 years old, and for 47 years, that 67, I was a traditional machinist, which I run mechanical engine lathes, mills, grinders, and I'm constantly standing all day, bending and standing, bending and standing. And that took a toll after a while, along with the fact I'm a motorcycle enthusiast, which I did a lot of hard riding in my years, and also I like to play golf. But unfortunately, I was unable to walk while golfing, so I was told I could take a cart and ride in a cart. Until that was unable, I couldn't do that either. So I went to the pain clinic about 6-7 years ago, and they fed me a series of shots in the back and shots in the back until I was up to 16 shots a visit. And it lasted 2 weeks, so I kind of give that up. And they also put me on unbelievable drugs that just zoned me out to where I couldn't work. And my doctor just told me to take Norco and Tramadol and live with it until it got so bad that surgery was an option. Well, surgery is not an option for me. When I got here and talked to Dr. Miller, I was depressed. I didn't have any smile on my face. I was in pain. And we went through my treatment program and how it would benefit from going through the DRX program into the Spine Flex program, and hopefully things would straighten out for me. Well, today is my last day of the 10-week program, and 2 days ago I went and played golf, and I walked. And believe me, the satisfaction I had with a smile on my face saying, I walked down the fairway playing golf. Even though it was 37 degrees, it got cold, I got in my truck and went home. So I played 4 holes, but that was a life-changing event for me coming through this program. And if anybody has any ailments like I do or anybody else with back problems, this is the place to come and have a consultation with Dr. Miller. The professionalism at this place is just unbelievable.
He got his quality of life back, didn't he? That's awesome to hear. You have an upcoming neck and back pain seminar that many people need to sign up for.
We do, Leanne. So I'm holding a free educational seminar for people that can relate to Harry. They're frustrated because they're just not getting the answers or the results that they're looking for, frustrated taking the drugs, shots, or surgery. But at this seminar, I'm going to be explaining what these different conditions actually are and why they affect people in such a negative way. Mm-hmm. We're going to talk about many treatment options available that are out there, side effects, pros and cons of each. We'll talk about my spinal decompression program. This is a way for people to find out why they're consistently hurting and not getting better, and learn about new non-invasive solutions that we can offer them as well.
And if they can't attend the seminar?
Yeah, if you can't make it, you can call our office today, and we have a great special for $49. We'll do a consultation and a thorough exam to get to the bottom of their problems and get them answers and start working on solutions so they can enjoy their life once again.
Awesome. All right. Make sure you reach out to them. If the phone is busy, just keep on calling. Thanks for stopping by, Dr.
Thank
Miller.
you.
Sure.